A running stitch is a great way to close tissue in a very time-efficient manner. Right now I'm going to show you two different ways to do a running stitch. They both start off just like a simple interrupted stitch. Of course, you can hand tie or instrument tie these. If you're going to conserve your suture, it may be nice to instrument tie. That way you'll make sure you won't run out. Surgeon's knot or regular square knot is fine. If you're using the nylon, you're going to do 6 knots. So that's 1, 2, 3, 4, 5, 6. First I'm going to show you the standard, most common way to do this stitch, and then I'll show you one that's a little bit more cosmetically pleasing. Examples of when you would do this: you could do it from closing skin, closing the subcutaneous fat layer for obstetrics during parts of an episiotomy repair. For this stitch I'm going to go in here and come out here, in here and out here. So it's 1, 2, 3, 4, 5, 6, keeping everything nice and parallel. So what you realize is that the parallel part will go under the skin, and then what the patient sees, which is above the skin, will actually be a series of diagonal lines. So we pull this through, and you'll see that more as I get a couple more, but I'm going to go here and come out straight across. So going straight across under the skin, and again, if possible, try not to touch the tip because you will kind of dull it, but if you know that you're getting towards the end and you know you don't need a really sharp needle, that's okay if you have to grab the tip. So we go here, then we go in, come out straight across. And you want to keep the distances equal so everything looks nice and symmetric. Go in, come out straight across. So as you can see, these are each diagonal lines, okay? Now I'm pretty much at the end of my incision. So I'm going to take one final stitch, and then we will anchor everything down. And again, you can hand tie this last one or instrument tie. It's kind of getting a little bit short, so it may be a little easier for me to just instrument tie this one. Surgeon's or regular knot is fine. Grab the top of the loop. 1. Now you can see it loosen up a little bit, but with my second knot, I can actually tighten it down, especially since this is monofilament. It will slide a little bit when you throw to complete your first knot. Now that I've done my first knot and this is my second knot, now the tension's pretty much set. 3, 4, 5, 6, and we can just cut this about 1/2 centimeter long. Now on the side here, I'm going to show you how to do a running stitch with parallel lines above the skin and the diagonals below the skin. It's really just a matter of style, but you know, if you're doing cosmetic surgery, the patients may find this a little bit more cosmetically appealing, and so you may want to just go ahead and do it. It's really not that much different than doing it the way I showed you over here. We can instrument tie these guys. Now again, it's loose. This one will kind of cinch it down a little bit more. 3, 4, 5, 6. That's this guy. So now we'll actually start here and go diagonal under the skin. And now for here, instead of going in over here, I'm going to go in straight across from where I came out on that side, and I'll go under and get my diagonal under the skin. And as you can see, these from the patient's perspective, these lines all look parallel. So I'm pretty much done. I can throw my last stitch. And cut this again, about 1/2 centimeter long. And that's all there is to it.